everyone, I am Macy Grace B. Faramiran from Pinwa University of Iloilo. And for today's video, I'm going to perform the management for the shoulder dystocia. So the shoulder dystocia is a birth problem that is increasing in incidence because the weight and therefore the size of newborn is increasing. Let's go to the assessment. So first, we are going to assess the woman to be transferred to the nearest consultant unit or the hospital for the delivery. Also, we should assess the client's ability to follow instruction. Planning. So first, I will gather all the items needed for the procedure for the easy accessibility. Next is the implementation. So identify the client, introduce yourself, and explain the procedure, which is the internal examination. So, good day ma'am, I am Macy and I'm going to be your nurse for the day. So, I'm going to perform the internal examination to check for the progress of your labor. So, next is the position the client on the examination table. So, there are 3 positions that are being employed for the internal examination. So it is the dorsal recumbent, the Sims position, and the knee chest position. So ma'am, you will be positioned in the examination table to assess the progress of your labor. And ma'am, I'm going to put a drape on you for your privacy, and I'm going to expose only the part that I only need to be assessed. So I will do hand washing and put on examination gloves to assess the client's progress of labor. So I cannot perform a hand washing because we don't have a faucet and I cannot perform well the hand washing. So instead I'm going to sanitize my hands only. So I already put on my examination gloves. And during the emergency delivery, I will notify other healthcare providers to assist or back me up during the emergency delivery and neonatal resuscitation. So now we are going to perform the Mac-Roberts maneuver. So Mac-Roberts maneuver is done by grasping the mother's posterior thigh and flexing them against her abdomen. So I will instruct the mother to grasp her posterior thigh and flex them against her abdomen. So this is So next is the Mazinti maneuver. So it is done by applying suprapubic pressure applied with the heel of clasped hands from the posterior aspect of the anterior shoulder to dislodge it. So this is done by another healthcare practitioners. So it is done like this. So it is grasped and it is the other healthcare practitioner should be applying suprapubic pressure here to deliver the baby. So next, the vaginal approach by doing Rubens maneuver or the reverse wood screw maneuver. So this is done with inserting my fingers beyond the posterior aspect of the anterior shoulder and rotate the shoulder toward the fetal chest. So it is done by inserting 2 fingers. Moving fingers here. So the rotation of the posterior shoulder. So this is what the wood screw maneuver is done by inserting 2 fingers on the anterior aspect of posterior shoulder while pressure is applied to the anterior aspect of the posterior shoulder and an attempt is made to rotate the posterior shoulder to the anterior position. Doing the manual removal of the posterior arm. So delivering the posterior arm is done by applying pressure intravaginally at the antecubital fossa, which causes fetal arm to flex and will grasp it and sweep across the chest and towards the opposite side of the fetal face. Episiotomy. Nurses can perform episiotomy and should be done by the obstetrician. Next is the Gaskin maneuver. So it is done by assisting the client to roll onto hands and knees, and I will apply a downward traction, which is to pull downward to deliver the posterior shoulder that can be repeated until the shoulder of the fetus is delivered. So baby girl out at 7:30 a.m. So after I call out the time of the birth and gender of the newborn, I will check if the baby is crying. If the baby is crying, I will proceed with the EINC or the essential intrapartum newborn care. And if the baby is not crying, so I will cut the cord and resuscitate the infant. So after the delivery, I will assess the baby's motor reflex and check for the fractured clavicle or humerus for possible injury. So after the delivery of the placenta, I will check for its cotyledons. If it's complete, I will assess the perineum and the vagina for lacerations to assess for postpartum hemorrhage. And then, I'm going to remove my gloves after I clean the instruments, and I will wash my hands after. I will document the date, time, and the procedures and record what was done to the patient. That's all for the management for the shoulder dystocia. Thank you.